Hello, everyone. My name is Jennifer Smith, the Community Liaison at Klamath Hospice and Palliative Care, a member of the Oregon Nonprofit Hospice Alliance. Today's presentation is hosted by the Oregon Nonprofit Hospice Alliance, also known as ONA. ONA brings community-based nonprofit hospices together to provide the best care possible for patients and families facing end of life. As nonprofit hospices, we are mission-driven and heart-centered in our care, prioritizing people over profits. You can learn more about ONA on their website, onanetwork.org. Now, I'm very pleased to introduce our guest speaker for today, Emily Feldberg. She is Klamath Hospice and Palliative Care's bereavement specialist. Welcome, Emily. Now I will pass it off to you.
Hi, Jennifer. Thank you for the introduction. I appreciate it. And hi, everyone. As Jennifer said, my name's Emily Feldberg. I like to just introduce myself too, and then we'll introduce our topic for today. So professionally, I'm an Air Force veteran. Other than aircraft maintenance, I spent some time as a sexual assault prevention and response victims advocate. I'm transitioning into civilian life. I then became a hemodialysis technician, and that's where I really learned about hospice and the value of it, as well as seeing and experiencing grief processes too, making connections with our patients, their families, as a healthcare worker. And today our topic is grief's journey, navigating anticipatory grief. So at the end of this, I hope that you learn a little bit more about what anticipatory grief is, as well as some ways to cope with it. Okay, so let's get started. So we have the quote, "Some things in life cannot be fixed, they can only be carried." And this is from Megan Devine. She's a psychotherapist and author of the book, "It's Okay That You're Not Okay." So why did I choose this quote? And I just like this because some things in life truly cannot be fixed. But we can love our person through it, we can support them, and we can make space for their feelings, because ultimately we may not be able to take those feelings of pain away from them, but we can make sure that they're not alone and that they have our support throughout that process. So first, what is grief? Grief is the natural and internal reaction to loss. Grief is personal and unique to each person and to each loss. And we all may recognize the weight of grief, but how we experience it and what we associate with it is deeply shaped by our own experiences, our personalities, and relationships with the loss. That is why I can ask someone, "What is grief to you?" And someone may describe it as feeling like the ocean. Others may say it's like glitter. It's different for each person too, and that's okay. But grief affects us cognitively, behaviorally, physically, emotionally, and spiritually too. So grief is a lot, but we also like to know that it is normal, and there is support out there for when you're grieving. What is anticipatory grief specifically? And anticipatory grief refers to the internal response to an anticipated or impending loss. So this is prior to that death event when we're talking about terminal illness. A person may experience it for, like I said, terminal illness, a degenerative disease, or impending losses too. And that's where divorce or teen leaving for college, pregnancy complications can also bring about anticipatory grief. And I like to remind people too, is if you think about it with our day-to-day lives, that even positive events may bring a degree of grief with it. Think of retirement, that's a big change, and you're going to have a little bit of grief in that experience, as well as that transition to parenthood too. Our identities changed, we're going into new roles and responsibilities. So even with new beginnings in life, there sometimes is a degree of grief in there too. For anticipatory grief, what affects us too is we see a loss of cognition in our person, the loss of their abilities and independence, personality changes, and a loss of knowledge too. That might be that they were the person who would always share stories with us from our heritage, and now we have that loss. And our grief can be intensified by outward stressors too. So that's that caregiving role and responsibilities. Maybe you were unfamiliar with medical equipment and now you have to learn about operating an oxygen concentrator. That pushes us into a new skill that maybe we don't feel as comfortable in or as competent to. So that's another stressor. Another is financial stress. With my mom specifically, she experienced it too of when she was fighting breast cancer for the second time as she received her treatment in another state, and that financially is stressful. Feelings of isolation and exhaustion. This is a very time demanding job and it demands a lot of our emotional energy too. So these are outside stressors that can also affect our grieving process. Our common grief reactions though, so grief affects, us because we're interconnected person. It affects us cognitively, physically, emotionally, behaviorally, spiritually, like I said. But some feelings of anger, relief, sadness, and guilt, or maybe you're having feelings of numbness, that it's so much to comprehend that I just don't feel nothing at all. Difficulty concentrating, your reading comprehension can go sideways, loss or strengthening of faith, and longing too. So those are really common grief reactions. I know from my experience with facilitating groups too and talking to our families and our patients is they might be preoccupied with the thoughts of their person and their illness, and also having those thoughts if I really miss them of how they used to be. And those things are okay too. So, our common misconceptions about anticipatory grief, as well as grief in general, is you can't grieve the future. Well, we know that yes, we can. Hopes and dreams in our future are also losses that we need to grieve and mourn. And throughout life, we're going to have these different seasons where that pain is more intense too. So I like to say the calendar is not always kind. So we might have these loss events, and then right after we have an anniversary or we have the holiday season that can kind of intensify these feelings. Another is what we say or what those around us say. And my favorite example is at least blank. This is coming from a place of good intention where we're trying to make them feel better. But like I said in the beginning, not always can we take that pain away, right? We need to acknowledge and help them feel not alone, but also heard. So grief is not something that can be fixed. It can be heard. We try to avoid using silver linings or making those attempts to make them feel better. And instead, we're here to listen and not judge them. And then another misconception is they're still declining. Am I doing something wrong? And that's really remember when we're caring for someone with a terminal illness, that providing care and comfort, you're doing that to someone with a life limiting condition. And an increase of symptoms is not a measure of care. But we like to make those comparisons and those judgments when giving ourselves grace and that we're doing this care so lovingly that it's not a reflection on what we're doing too. So I have a discussion question for you to kind of think of for a moment. And that is, what is the difference between grief and mourning? And is there a difference between grief and mourning? And I'll give you a hint. Yes, there is. We might use them interchangeably, but there is a difference. And that's because grief refers to the internal response to loss, and mourning refers to the outward expression of loss and how we integrate it into our life. So I like to think of mourning as grief gone public, and it is important for us to not only grieve, but also mourn. So how do we cope with our anticipatory grief? And I think we have some great content that'll point you in the right directions of support, as well as good reminders to take care of ourselves along this process too. So education and planning. It is helpful, excuse me, to learn about the person's condition or conditions. And that's with speaking with their healthcare provider about their current or expected symptoms, conversations about their plan of care or goals of care, And this is not a one-time conversation, right? These are ongoing conversations throughout their experience. And what we encourage people to do is write down your questions before you're visiting the doctor, or take notes or ask for a summary of the visit too, because our brain is going to be overloaded with information and it's difficult to remember that. So that's why we like to use our note-taking skills, maybe bring someone else with you. Those are some good ways to help us cope with those. And then having also these difficult conversations. So that's when we're talking to our person and we learn their wishes related to end of life care. And we try to talk about funeral homes. We try to talk about cremation or burial and decisions related to life sustaining treatment, because it takes some of that guesswork out later on. And not always is the person going to be open to having these conversations. So we might bring it out there, but we can't force them to participate, of course, too. And also, what we can do is we can start arranging necessary paperwork ahead of time for medical and financial planning, as well as applying or checking eligibility for benefits such as veteran benefits, state benefits, whatever that may be, to start kind of building in those resources and starting some additional help. So finding support, and I like to have some organizations on here too. So support is essential in navigating this journey because you are not alone. So I like to steer people towards the older adult services or area agency on aging that may assist you on identifying services for someone who's 60 years or older. And you can also find the phone number for their local office by going online for the Oregon Department of Human Services and entering your zip code. So it's very simple to do. When someone's on hospice care, this is where your social services or social worker can help you too. And if your person is receiving hospice services, then maybe talk to their team about arranging a volunteer. And the volunteer coordinator can see if it's appropriate to arrange a volunteer for scheduled visits that may benefit both yourself as well as our person who is experiencing this condition. And I have our own affiliates too. So we have care partners with the different counties, Washington, Multnomah, Columbia, and Clackamas counties, and then Klamath Hospice and Palliative Care for Klamath, Siskiyou, and Modoc counties. And then Lumina too for serves Lynn, Benton, and parts of Lane and Marion and Polk counties. And you can tell that I'm a transplant to Oregon because I might have mispronounced those wrong. So please give me some grace too in there. But these are wonderful agencies, and I so appreciate being able to talk to you all today too. So finding support, we have more organizations, and this is something I love to show families. And this is that, yes, this is the U.S. Department of Veterans Affairs to the VA Caregiver Support Program, but these listed resources, they can be accessed by anyone. So they can be accessed by the public, and they have some really great information on there. So they have legal and financial videos, checklists that can be printed, and truly one of my favorites is the questions to ask a veteran's healthcare provider. Is that person doesn't have to be a veteran to take some of those questions away to say, oh, this is something good that I should ask their doctor, and to gain some more information about. So really helpful tools, and it's accessible. So also consider attending a local or online support group. They're out there, and not always do we find effective support within our family and our friends. So that's when we can talk to a support group and really get that time of non-judgment and being heard and not feeling as alone in this journey. And our other supportive resources are moderated blogs or discussion forums. Books, podcasts, videos, counseling, wellness centers. There's a lot out there. And I'm not saying this is one size fits all. So if some of these don't appeal to you, take what you would like and use those, because like I said, grief is unique to each person. And someone may be more interested in seeking counseling while someone else says, listening to a great podcast while I'm doing dishes is what I really want to do. So there's resources out there for what you're willing to try, and a lot of it is just trying different things and seeing what's going to work too. So finding support through our community, some family and friends may be willing to and able to help. And yes, it's okay to ask for help and still have boundaries too. So some great ways that for asking for help that I like to have some ideas is instead of saying, "Hey, can you help me?" And then the person not being so sure about how they can help, is to identify a task or time that you can have help with. So an example is, it would be really helpful for me if you could stay with mom Tuesday night so I can go to my book club for 2 hours. It's kind of concrete, gives that person an idea of what you're asking from them. And it's a good idea of how we can ask that question, because asking this question is not always as easy as we think it's going to be. And then offering help, for my support people out there, is if you're supporting someone who is the caregiver or someone who is experiencing this different process, is consider offering specific help instead of saying, let me know if you need anything. And that's because if we say, let me know if you need anything, as I'm expecting this person who's grieving to identify something that they need help with, and then also feel comfortable to ask me for help. And like we just talked about, asking for help is not as always as we think it's going to be. So accepting help is easier than asking for it. So ideas, we can pick them up a meal or a bag of groceries, help with phone calls, household chores, whatever you and your person are comfortable with. So if you're a support person, remember it's okay not to have the right words to say to our person who's grieving, but a person who's willing to be supportive, present, and able to listen is incredibly valuable. So memories, the past and present. Reviewing their life story with one another may bring a sense of comfort and connection with your person. Allowing for the creation of new memories. Often the very significant memories that are cherished are small and innocent experiences. So that can be always going with that person and buying winter fresh gum. Like this is your thing that you did together. So allowing these new moments for new memories, as they can be very powerful and very special to us. And then I love this one, is build something together, such as an art project or activities, especially if there are small children involved. This is a good way for them to participate and have fun. So remember, children grieve too, and we have many resources available for supporting grieving children and supporting the person who's supporting the grieving child too, the parent or guardian. But getting the kiddos involved is a great way to get them to do something. So maybe that's assembling a recipe book together. Maybe that's doing an art project, whatever it may be. Like I said, very even small and innocent experiences, they're very special. And of course, we have self-care, and self-care is sacred. So taking care of ourselves can be separated into different sections. We have our physical, our cognitive, emotional, professional sections. And most sections we take care of well, but we tend to neglect one or more. And I'm also guilty of this. So self-care activities can affect multiple sections. So I'm not saying you have to have one for each of these sections, but for me, walking my dog is so powerful for me. So it's going to affect me physically, emotionally, cognitively. So that's what I'm kind of talking about, of one activity might affect you in these different sections. And this is where we can think of them. So drinking water, it's very simple. We can do it. It's a great way to take care of ourselves. Making time to go to the doctor or counseling appointments, especially if you're a caregiver. We know that because your person is, you have to take them to their medical appointments, that you tend to start neglecting those. So we really encourage you to see if we can set up resources and get you to your doctor's appointments, or think outside the box and do some virtual appointments if possible. Exercising, walking, yoga, making to-do lists. I'm the person who gets the satisfaction of crossing something off for our to-do list. That's a great way. Affirmations, meditations, spending time with animals, setting goals. And I also like to say small goals, especially when someone's starting to decline more, as we can just take our day and break it down into smaller moments too. And then taking breaks. And yes, even if it's a 20-minute break, it can be helpful too. So a little activity for you to do for yourself is, what are you doing for self-care? So think, what am I doing to take care of myself? And I also like people to think of, what are there any barriers out there that are preventing you from taking care of yourself? And then finding new ways to say, Okay, maybe I'm doing yoga, but I can't drive to my yoga class. All right, let's see if we can do yoga at home, throw on some YouTube videos for guidance, whatever that might be. So really, it's what's going to work for you and what's okay for your body too. So we have another quote, and that's being a caregiver for someone you love is a gift to them and to you. However, caregiving can also be stressful and exhausting. And over time, you may find yourself becoming more overwhelmed and run down. Then you feel guilty because it's a gift, right? And that's where you live matters, preventing caregiver burnout, is that you're doing an amazing job caring for your person and also giving ourselves lots of grace over guilt along this because we are going to make mistakes. We are human. And also seeing if we're getting support that we need to as the carer. And this is our mourner's rights. So it's okay to grieve, for grief to be happening before a loss takes place. It is valid. Some days you may feel ready to express your feelings. Other days you might feel desperate for distraction that can help you feel like yourself again. I have the right to know about the truth and my questions answered honestly, and so you can understand them too. So slowing those conversations down and making sure that you are understanding and comprehending those answers. You have the right to be heard with dignity and respect. You have the right to not agree with other people's perceptions or conclusions. You will be critiqued, of course, too, and that happens. That's why we have a place where we can feel support and feeling of not being judged. You have the right to feel a multitude of emotions, and you have the right to be tolerant of your physical and emotional limits. And why did I bold that? I bolded it because maybe in our beginning, we thought we could do something, and now we say physically and emotionally, I can't do this. So that's when we have to consider, something that we didn't before, such as placement or another different option. And it's okay to recognize those limits, especially when it's for your safety and the safety of the person you're caring for. Okay. So giving ourselves permission to do those things is very important, and seeing if we have a good support system where we can talk to and feel heard and kind of um, brainstorm about different resources available. So remember to be kind and patient with yourself as you and those around you experience this anticipatory grief differently. Find comfort in what is shared and embrace what is unique to you. So if you have any additional thoughts or questions, please know that you can contact us for follow-up. My contact information for work is here below. And I also want to show you my sources, and that'll be it. So I appreciate having your time, and always available for any additional questions or for help arranging outside support, because I can help with whatever I can help with. So thank you.
Thank you so much, Emily. That was great information. Once again, I would like to thank the Oregon Nonprofit Hospice Alliance for sponsoring this free talk. Thank you, everyone. Have a great day.